you, Dr. Harrington, for being here today. Can you tell us a little bit about who you are and what you do?
Sure. I'm a pediatrician. I work down at Norfolk, Virginia, at the Children's Hospital of the King's Daughters, and I direct the Division of General Academic Pediatrics. And we see 30,000 patients a year, of whom many need to get vaccines. And so we direct this along with residents and medical students. So we're essentially a teaching facility for 200 medical students and about 50 to 60 residents.
Amazing work.
Thank you.
You spoke to alternative schedules and vaccine refusals. What is the best advice you can give to a healthcare provider on how to discuss that issue with parents?
I think when a parent comes to you and states that they're not interested in a vaccine or that they would like to delay a vaccine, I think the most important thing is to find out why. Essentially, many parents may have either not the right information, may have no information, or may have some type of information that's not gelling with what they understand. And in defense, a majority of parents, they want to ask questions, but they're not really sure how to address it with their doctor. I think if you're open to saying, do you have any questions on the vaccines? And I do that openly even before we give vaccines, but just to have an open sort of easy communication between the parents that you're not going to do something that they don't want to do, but at the same time you're going to give them your best advice as to what's the best thing for you to do. And I think most parents will embrace that as, they're looking out for the best interest of my child. Now you're going to have what I call fence sitters, or parents of patients who think that, well, I'm not 100% sure. And, we'll talk with them, provide them some information, and, at that time, if they decide not to vaccinate, I don't necessarily have them a refusal to vaccinate, but I do document in their chart and tell them that I would like them to come back, maybe in a shorter time period to either bring their child back for vaccination if they're thinking about it and they want to get it done, or I give them an open, what's called a service visit, to come back and do that at any time. When they do come back, and if they have not had a vaccination, then we do provide a little more pressure, if you will. And I think that's where you have to engage and then continue the sort of, if you want to call it a selling point, of the benefits of vaccines, which is basically saving your child's life. And if that doesn't sort of resonate with a parent, I'm not sure how else to do it. There are some that I call the fanaticals, essentially, or someone who's basically, it's their mission to tell you that they don't need vaccines and to convince you that probably vaccines aren't good. Those patients are a little harder, and those are you're gonna have, I call them missionaries or whatever. They're gonna, their mission is to make you not want to give them a vaccine, and that you will now agree with them. So I think those parents, we have a whole thing about refusal to vaccinate, and the AAP provides this for them. It's a sheet that the parents fill out, and it states pretty clearly that they're refusing to vaccinate their child with vaccines that will save their child's life. And if indeed that their child does come down with these things that they were explicitly told what the dangers were, and if their child does develop these illnesses, they have signed off that they did not want their child. We don't discharge patients from the practice, but we do then say, if they haven't had their vaccines at a scheduled time, that when they do call, we will ask, are you vaccinated? And if you're not, then you're probably going to go into a different setting, meaning we have a separate setting for patients who have a fever, who show up to the office, who have not been vaccinated. So we try and isolate them from the rest of the practice, much like we do with our cases of MRSA, methicillin-resistant Staph aureus and stuff like that. And they get a big flag on their chart that says, this patient is a contact precaution with a fever, and we need to sort of, provide universal precautions for this patient.
Thank you. Dr. Harrington, what are the risks of choosing alternative schedules and/or refusing to be vaccinated?
Again, it goes back to, what is the risk? And a lot of parents want to know, what is my risk? And, actually I was looking at this just to sort of find something that would resonate with regular people. And, the risk of taking the MMR, if you look at the things, what is your ultimate risk of having an MMR? What's going to happen to you? And I think Dr. Offit, who we were speaking with earlier, had mentioned some things. But in reality, it's about a 1 in a million chance to have any sort of real side effect, like encephalitis or some type of bad outcome. Now, take that another thing. If you get in your car, you have a 1 in like 200 chance of having an accident every time you get in your car. Okay. A lightning strike. The chance that you will be hit by a lightning strike for your life is 1 in 10,789. Okay. So, I mean, but still, it's 1 in a million for any type of problem that could happen with the MMR. Now, if you take the MMR, if you do not take the MMR, you have basically, and you get the measles, you have a 1 in 1,000 chance to have an encephalitis problem. That's 100 times greater, 1,000 times greater chance. So when you look at risks like that, I mean, what you do in your regular life and what you decide to do. Insurance companies use this, what's your risk of dying? If you smoke, you're going to get a worse policy and stuff. With this, if you have a vaccine, I mean, if you're not taking your vaccines, I mean, in all honesty, if I was an insurance person, I would say, you're a high-risk person. I'm not going to give you insurance. I mean, so it's really, it's a cognitive choice. It's also it makes sense choice, and it's for your life. So I mean, essentially, your risks of not taking the vaccine far, far outweigh taking the vaccine.
Very important message. Thank you. And our last question is, why does it matter to the parents whose children have been vaccinated when a parent decides not to vaccinate? Aren't the children that were immunized protected?
That's an interesting question, and probably, immunologically speaking, it would make sense that you should be cocooned or somehow protected by having had the vaccine. But it does say that if you're exposed to a live, sort of virus in its sort of native form, that even having the vaccination, they're not 100%. And so if someone comes to you and has, measles, flaring measles, they got their fever, they've coughing and stuff, and you've been vaccinated, you're not 100%, protected. So because that person elected not to immunize themselves, now they've put you at risk of that 5% risk that maybe you would, if you're exposed to that, live virus, that you would actually get it. And, to me, that's just sort of unconscionable. It's sort of the same thing, when we go into a hospital room and we don't wash our hands, or we don't put a mask on when we have a cold, and these other things with an immunocompromised patient. I think you're doing the same thing with kids and stuff. If you're not vaccinating your child and you bring that child into a waiting room with all these other healthy newborn infants. So when a child comes into the emergency room or your office and is unimmunized, they're basically affecting the office. And for a parent to do that, or knowingly do that by not vaccinating their child, is putting everyone else at risk. And that really does not seem fair, and in most cases is not fair. And that makes it very difficult for the practitioner to tell a parent that I'm going to under-immunize you, or I'm not going to immunize you today, knowing that they're putting the rest of their patients, or the rest of the patients in their practice, at risk.
So important. Thank you so much for answering the questions today.
Thank you.